take a collective deep breath. Let's pledge to schedule that physical, that mental health check-in, that exercise you have been wanting to join, or even just 15 minutes where you aren't being a CEO, a mother, or a superwoman. Be the woman who invests in herself. Your health is a real treasure. It gives you the energy to be fabulous force of nature that you are. So go ahead and treat yourself to good health. It's the only outfit that truly fits all. And remember, a healthy woman is a happy woman, and a happy woman is an unstoppable force of nature. So be that force, be happy, be healthy, and celebrate your strength, not just today, but every day. And I thank Parveen ma'am, Akbar sir, for giving us this wonderful opportunity and I acknowledge their service to the humankind. Dr. Sama as well. You've been doing such wonderful things for the life of others, and I've seen in a colony where we live, they are known as the couple, they walk, they help, they take care of themselves so well, and they inspire everybody in the colony. And we always say, the couple, the smartest couple in the colony. Thank you so much. Thank you so much.
A very good evening. Anevarukkum Maalai Vanakkam. This is a very important day, I would say, for Oxymed Hospitals for kicking off this wellness campaign today, and being in the holy month of Ramzan. I'm really honored to be here, and thank you, sir, Dr. Ayaz Akbar sir, and also Sarah ma'am, and the family of Akbar sir, and all the people gathered here today. I can see there are doctors, I can see there are so many, and some patients are there, and the ladies who have achieved the award for the reasons, of course, best known to the organizers. And today you are celebrating this, commemorating Women's Day, which is tomorrow, March 8th. We are on the pre-Women's Day. So I would say, and also I like to welcome my colleagues who are there from JBS College, Dr. Anjum and Sumaira and Dr. Jasmine, and also, okay. So, and so many other guests also are there, special invitees and other doctors. So Women's Day is being, it's commemorated today, and I have the opportunity or the acquaintance, I would say. I also was there for the World Heart Day celebrated by Oxymed. I don't know how many more programs they are doing as a service to humanity, to the community, and lots more. Wish them lots to do lots more in future. So just a few words, because I come from, I'm a principal and correspondent of SIT College, and basically, we stand here for the cause of education. But myself being a doctor in philosophy, I do have my father is a doctor, he's a general medicine, and also my son is a doctor, but I don't come in the doctor stream. I'm a doctor in philosophy only. Somehow God had different faith for me, and I didn't become a doctor, although my father very much wanted me to become a doctor. But Alhamdulillah, whatever it is, every time we have to thank the Almighty for all the grace and for all, and be grateful to the Almighty for every minute of ours, because as we are talking about health, okay, health is wealth. All of us know it's a very old proverb, but even today, that is what counts, because you are happy only when you are healthy. If you are not happy, only when you are wealthy, but if you are healthy, definitely it is a happy moment. And since today being Women's Day, let me just, I was just few days ago, just a small incident I would like to share with all of you. One of my staff, she's a non-teaching staff, she's just about to retire, okay? Just in the month of, in a few months from now, she's going to retire. So one day she just came to me and she said, I said, what is it, what do you want? She said, please, I'm going to retire. Yes, it's a happy moment, you have done so much of service and you want to, you are retiring, it's good. When you're healthy and you are retiring, it's a great sign for anybody, for the working women. I told her, but she said, no, please do something and help me to extend my job here. Even if it's from the lesser paid job. She's now getting quite a good salary because she's done her service for a lot of years. Because I don't want to sit at home. I don't want to be idle. I want to work. And she was that little, the passion from her side really made me think. Okay, so it was because if I sit, I will become idle, and I don't want to do that. I want to keep on working. So that passion is there. So it is like, working women. We are having a double role to play. A housemaker, yes, a homemaker, a housewife is. Really you have so many jobs on hand, but to be also a working woman, and when I say working women, it's all from all strata, from all fields. All of us have that extra responsibility, and I, as Dr. Ma'am was just talking about that, how we have to care for ourselves, we have to be for ourselves. We all know that, behind every successful man there is a woman, we say that, and there is also, it's a famous saying. But for, who is there behind every successful woman? Herself, yes. She has to be there. There's nobody. We have the support, we have the help from all angles. But, the woman herself has to come forward, has to have the will, has to have the grit and the determination to do her best to come out in flying colors in whatever field she is, whatever work she is doing. So that is an important choice which she has to make, and that is what makes a woman of substance, a woman who is resilient, who works the hard way as well as the smart way, and also is of service to the community. Then it's a very important thing, very good thing which is to happen. And also I would just like to add, for the as a part of the wellness campaign, I was just thinking, there is
nice to have everyone smiling faces and such a lovely decor. Nalla oru different concept பண்ணிருக்கோம். So it symbolizes how fragile life is, being held by a thin, flimsy band, and inside we have such precious flowers inside. So that band is basically our health. If we don't preserve it, all those flowers will fall down. We are hanging on. So adukage we have to really look into our health. So especially with regards to these pink flowers, they are our women, and they are very much more important than the other sex. Because they are our mothers at the end of the day. So to begin, we have a small series of questions. I think the members of the press also can be invited. Neenkoda kelvi kekala, definitely will be more than happy. To just start the ball rolling, konjo general questions which we had thought about, which would be addressed to some of our panelists here. So to Dr. Sharanya, this question is addressed to you. When is the right age for women to start health screening, and how often should these screenings be done?
Good. Actually, that's a very important question, sir. So I think women per se, probably, once you get married, you can start doing your pap smear screening. But a general health screening, I would suggest any woman about 30 can start having a regular health checkup every year, I would suggest. But if it's a pap smear test, you have to get it done every 3 years once. So up to 65, we suggest your pap smear screening to be done every 3 years, irrespective of it being negative the previous time and irrespective of your vaccination schedule. So even if you are vaccinated against cervical cancer, every 3 years once, if you can get a screening, we'll be preventing a lot of cervical cancer patients, because it's second most leading cancer in India for women. So I think that's enough and more has to be spoken about it, so that we can prevent something that is totally preventable.
Thank you, ma'am. And it's also a very gruesome disease. Once it sets in,
yes,
the kind of treatment which involves for cervical cancer is very
gruesome. Radiotherapy and the only thing is, actually usually if you look at malignancies in women, cervical cancer is the one that is affecting the reproductive age group. So we usually, when we were studying, we used to say 30 to 45 is cervical cancer, 40 to 60 is endometrial, and 60 above is ovarian.
Yes.
So that is such a young and fragile age group of women that we're looking at. So it is very important that we we're able to.
Heart disease risks in women, and how hormonal changes during premenopause and menopause influence these risks. So common misconception that heart disease does not occur in women. In fact, I would claim that with the kind of lifestyle we are having right now, with the kind of fast food, with the kind of intake and lack of exercise we are having right now, the protective component of estrogen and progesterone, which is there in fertile women, is almost becoming nullified. இப்போ நிறைய கொலஸ்ட்ரால் ஃபுட் சாப்பிட்றோம், லேக் ஆஃப் எக்ஸசைஸ் இருக்குது, அதிகமாக ஸ்ட்ரெஸ் இருக்கும்போது there is actually a very high likelihood that they get heart disease because they are also complacent because of that bias. இப்போது ஜெண்டர் bias ஒரு இருக்குது. இப்போது நம்ம ஒரு any study we have done, any international study also நம்ம பண்ணும்போது health related study, ஒரு medical study, if we take 100 people who participate in the study, 85 will be men. Only 15 participants are women. ஏன்னா women usually they don't want to come forward to get tested also. Neither do they want to recognize that they have disease. Okay, tire puncture irukna, okay, we'll manage, adjust. Only when it becomes ஒரு malignant condition, இப்போ ஃப்ராங்காக நம்மளுக்கு தெரியுது there is a evident swelling, இல்லை கால் வீக்கம் வந்திருக்கு, இல்லை ஸ்ட்ரோக் வந்திருக்கு, அவங்களுக்கு ஃபைனல் எண்ட் ஸ்டேஜில் மார்வலி வந்திருக்கு, அந்த ஸ்டேஜில் தான் women tend to seek health care. ஸோ ஜெண்டர் bias கூட இருக்குது. அண்ட் இது பெரிமெனபாசல் ஏஜ் குரூப்பில் கூட there is no more protective effect of the estrogen and progesterone. Menstrual cycles, when they stop, in fact the percentage of women having heart disease at the perimenopausal age group, the incidence is increasing faster than that of men. Its incidence is much faster now. Obviously women also have some other special conditions to them like pregnancy and childbirth and breastfeeding. அதுக்காக அவங்களுக்கு they are susceptible for some specific conditions. இப்போ gestational diabetes mellitus, gestational hypertension, pre-eclampsia, eclampsia, அந்த மாதிரி கண்டிஷன்லாம் they are very very susceptible for a stroke, sudden heart attacks, coronary artery dissection. இதெல்லாம் it is not there in men at all. And deep vein thrombosis, pulmonary embolism, in the conditions are hardly seen in men, but because of pregnancy, because of change in hormones during pregnancy and childbirth, they also they develop a condition called peripartum cardiomyopathy. That is a rombo devastating condition. Imagine you are just giving birth to a child, or newborn baby, you have so many responsibilities, but your heart fails. You can't even breastfeed your child, you are in a pathetic condition, you don't have any blood pressure, you continuously keep fainting. Only thing which can save them is a cardiac transplant. And we have seen 5-6 cases. We have done successfully cardiac transplant also for those women. But these are special conditions and they should be addressed. If we don't address them, unfortunately, it becomes undiagnosed, underdiagnosed, and they don't get the kind of treatment at the right kind of time. So definitely these are things which have to be addressed. Women, you have a right, in fact a lot more right, because you are the backbone of the home. If that backbone fails, then I'm sorry, then we cannot function normally. So definitely women have to come forward and get tested at all age groups, as ma'am mentioned, not just for women specific conditions, but for general health and metabolic conditions as well, like diabetes and hypertension. Thank you.